It's probably one of the biggest questions we work with. How do we get more GP referrals for the private practice? And what makes GPs refer to you? Nick, nice to meet you.
A pleasure. Thanks for the invite.
Yeah, I see that you've got an interesting practice just outside Adelaide. Tell us a bit about your practice.
So we're Partridge GP. We're a general practice. We like to feel that we provide the best of services and facilities to patients, doctors, GPs, allied health professionals.
You're also a consultant. Tell me a bit about that. Why did you choose to put on those two hats?
I guess when I fell into general practice, which I literally did, I sort of found a job opening and jumped in there. And I did a job with GP on my board or on the outside the practice, said I was GP. But I didn't actually have GP qualifications. So I went off and studied and did postgraduate specialist training in general practice. So that's what the FRA CGP is. I've got a fellowship of the Royal Australian College of General Practitioners. So in my world, I look as GPs as specialists and other specialists as non-GP specialists. So that's the first part of the question. The second part of it is, being a consultant or wearing two hats. And I guess the other hat I would wear is as a general practice business owner, which as a GP, you've got all of that learned knowledge in medicine, but very little in business. And so learning the business side of things has definitely been a steep learning curve over many years.
Quite often working with our customers, the big question is how do we get more GP referrals, as if it's some sort of a tap that you can switch on to improve your private practice. So I'm very interested in hearing your perspective on that big question. Let's reverse the question. What can the specialist doctor do best to deserve your referral as a GP?
I think as a practice, what we say to the doctors in our practice is we don't direct where your referrals go. We expect that you will provide the best of care to patients because those are the sort of people we have in the practice. And because of that, I wouldn't expect anyone in Partridge GP to refer to someone who is going to provide a lower level of care than we would provide ourselves. And I think that forms the guidelines for our referrals. We refer our patients to the places where they will get equal or better care than they would from us.
What is the perfect relationship between the specialist and the community of GPs?
I think it's a meeting of two specialists. The GP is the specialist generalist and the non-GP specialist is the specialist in their area of expertise. And I think when it's a meeting of equals, then things move a lot better. When people are working out of a public hospital, for example, you have the concept of being a wall, hospital avoidance, preventing people from coming in. And that can lead to complex situations being overly complicated, which burns a lot of the GP's time and the patient's time and makes things move far less quickly than they should. So to my mind, the private specialist, the private non-GP specialist, has to look at what service they're providing. They've got to have a good relationship with their referring GPs, a good relationship with their patients, and a knowledge that this feedback is going to be acted upon. If you receive a referral from a specialist GP and you don't do the right thing by that referrer, that referral, or that patient, then your future referrals are probably going to dry up.
Is there a process where you have to really reflect on whether you send someone to public or to private?
I think we've got to recognise that the public hospitals are the providers of last resort. And that's not denigrating them. It's they have to deal with everything. There's no one there if they pass it up. And so I certainly am aware of that and I refer accordingly. I don't refer things to public hospitals that I can deal with myself. I don't refer people to public hospitals who can be treated in the private system, because it does the public system a disservice to have to deal with stuff that they don't need to deal with, and to have patients going through that process that perhaps could avoid it or be sorted elsewhere. So I think the public system is fantastic. It provides a much needed service. They do fantastic work there, but it doesn't mean that they have to do everything for everyone all the time.
Sometimes I hear these stories of wining and dining, spending time at the table over a bottle of wine. Is that still relevant in this day and age, Nick?
I think networking is fantastic. I think developing personal relationships with people is fantastic as well. I think we all know every interaction we have in any sphere of endeavour flows better when we know and respect the person on the other side of the relationship. I probably wouldn't be going out and wining and dining with people that I wouldn't ordinarily wine and dine with. I don't think it converts someone you would never refer to in a pink fit to, one of your best referrals to get a bottle of wine or to have a meal. But people don't know anything, or they don't care about how much you know until they know how much you care. And I think that the purpose of networking is to show that you are a legitimate provider with something to offer to certain groups of patients. The spirit of sort of openness and collegiality involved in networking and referrals, I think, only improves the service to the patients.
Now, what is the importance of the specialist's online reputation, their online profile, looking at it from your perspective as a GP?
I think the GP will have a certain amount of input into the referral process. You will have the providers that you know will provide a good service for certain conditions. When that's not the case, you will jump online, as will the patients. And then the non-GP specialist's online presence is like their online shopfront. It should be informative. It should give you an idea of who they are, what they do, and how they do it. There should be some basic information about price and location. And there should be very little friction in actually sending a referral. Having to jump through multiple hoops as a referrer is probably not going to result in a lot of referrals. Many of the public pathways, because they have to cope with such a huge demand, they have very, very convoluted referral pathways, which really, by design or by just chance, dissuades referrers.
Yeah. Yeah. Now, I know I speak on behalf of my audience and our customers when they would be very curious to learn about this less convoluted way of getting that pathway right. What is the easiest way for you to refer to a specialist? How can they make it really easy for you?
So, to me, when you want to have a conversation with a non-GP specialist, it's great to have their mobile phone number. We're all very, able to, we've all got mobile phones. We're all good with a text message. You can pick up a phone and have a quick 2-minute interaction with a non-GP specialist and get clinical answers very quickly. And I think mobile phone numbers are great. For routine referrals, things like electronic secure messaging like HealthLink or Argus, trying to avoid faxes and avoiding unnecessary phone calls. Interactions where my receptionist needs to call the non-GP specialist receptionist, who needs to call the patient, who needs to call me, that all just wastes time. We have online booking at our practice. Online booking is always appreciated. Any sort of asymmetric communication for routine stuff is good. Obviously, if you've got a clinical question, you want to pick up the phone and get an answer. But if you want to just send a referral, you don't want to have to call up and be both in the same place at the same time to do that.
A lot of our viewers and readers will pick up some ideas. And so let's hope for even better flow between the GPs and, as you call them, the non-GP specialists. Thanks for your time, Nick.
Thank you very much. It's been great talking to you. Thanks.